What's up, you guys? Cody here. So, I just wanted to talk a little bit today about my journey from antidepressants to TRT. That's right, you're probably wondering, how did I do that? Well, let me tell you, my testosterone levels being low greatly impacted how I felt about myself, my depression, my libido, everything. So, I want to share it with you guys. The struggle, life on antidepressants. My personal experience with antidepressants wasn't all positive, you guys. So it wasn't all sunshine and rainbows. While they were intended to help, I often felt emotionally numb and disconnected. This brain fog made it difficult to feel like myself, which led me to search for underlying causes for my symptoms. So I was never, the only thing I can really say about the antidepressants, it made it really hard for me to be bored. But the boredom was still there. But it's like I could never relax. There was always stuff going on, but my brain was always so foggy, I could never actually trust how I actually feel. So, my link between low testosterone and depression. So, after consulting with a doctor and getting my blood work, I discovered my testosterone levels were clinically low. So, obviously, my time in my addiction, being homeless, not eating right, using all sorts of different medications, all that stuff greatly impacts your testosterone levels. I was living a really unhealthy life for a really long time. Symptoms of low testosterone mimic depression, fatigue, low mood, brain fog. Research suggests a strong link between low androgen levels and depressive disorders in men. For some, antidepressants may even impact hormone levels, complicating the issue even further. So, I was on these different medications that were actually making it worse. My solution: medically supervised TRT, a new path forward. Starting testosterone replacement therapy was a medical decision made with my doctor. It wasn't about performance, it was about good health. The goal was to restore my hormones to a normal, healthy baseline. This was done under strict medical supervision with regular blood tests. As my hormone levels normalized, my mood and mental health clarity improved significantly, allowing me to work with my doctor to taper off antidepressants. This wasn't done quickly. I tried to do this multiple times, and it wasn't until recently, this last time, I was able to successfully do it. TRT is not a steroid cycle, you guys. TRT is prescribed from your doctor or just testosterone used responsibly at a very small dose. Medical TRT is a legitimate medical treatment to correct a diagnosed hormone deficiency. It uses physiological doses to restore normal levels. Supervision. It's prescribed and monitored by a doctor to ensure safety and manage side effects. Steroid abuse. Using substances for performance enhancement, often at super physiological doses. Stacking, combining multiple steroids like Anavar, Masteron, Anadrol without medical supervision. This is extremely high risk and illegal, and if done incorrectly, it can affect your libido, your ability to get an erection, your self esteem, your depression. This stuff is serious, you guys. What are Anavar, Masteron, and Anadrol? Anavar, medical name oxandrolone, was prescribed to help patients gain weight after surgery or chronic illness, or to treat bone pain from osteoporosis. Masteron, drostanolone, is an older drug. It was once used to treat breast cancer in women. It is no longer marketed for medical use. Anadrol, oxymethylone, medical use, a very high risk, potent drug used to treat severe anemia and muscle wasting conditions like HIV/AIDS. So it's known for putting weight on people, putting mass, hunger. The risks you weren't told. Using these substances can permanently damage your body and mind. Risk 1, liver and heart failure. Organ toxicity. Anavar, and especially anadrol, are known to be highly hepatotoxic. This can lead to liver tumors, peleosis, hepatitis, which are blood-filled cysts, and fatal liver failure. All steroids can negatively affect cholesterol levels, leading to hardened arteries. This drastically increases the risk of heart attack or stroke, even in young people. Risk number 2, guys, worsened mental health, which is the opposite of your goal. This is the most critical warning for you. Steroids can destroy your mental progress. Anadrol is known to cause depression, lethargy, and insomnia. Steroid cycles shut down your body's natural testosterone production, leading to a severe crash when you stop. This crash can cause severe depression, anxiety, and different ideation that you don't want. So yeah, guys, like, this is serious stuff. It affects how you feel. When you stop taking it, you can expect to not feel as good. But also, while you're on it, you're not always going to feel good. You're going to have extreme highs and extreme lows, even on low doses. Permanent and irreversible side effects. Psychological depression, aggression, dependence, and addiction. Hormonal, total shutdown of all natural testosterone, infertility, and testicular atrophy, shrunken balls. Cardiovascular, heart attacks, strokes, and high blood pressure. Liver tumors, liver failure, and jaundice. So guys, if you have any questions for me, feel free to reach out. Obviously, like, there's a way to do things safely, and don't just hop on to different compounds and, risk this irreversible damage to yourself. You don't want to be in your 20s with erectile dysfunction, because I suffered throughout my early 20s because I did a cycle incorrectly. So anyone who wants to talk about it, definitely reach out, add me on Instagram, because I would like to help prevent you from making the same mistakes I made. So that's why I'm talking about this. It's very important to be responsible and to do things right. So thanks for watching, guys. Have a good night.